Hello and welcome to the Birth Untethered podcast. I'm Shellie, a long-time doula, advocate and former university lecturer.
And I'm Kemi, a badass birth keeper, formerly a UK registered midwife.
Just a couple of rebels with decades of combined experience in pregnancy, birth and beyond getting together to share wisdom. We exist to equip birth workers, families and seekers of truth with informed choice, not fear. Come as you are, learn what they don't teach. This is the Birth Revolution and you're all invited. Hello everybody.
Hello everybody.
Welcome to this episode of Birth Untethered with me and Kemi. Beautiful Kemi.
Hi.
Look at that gorgeous outfit you're wearing. I'm loving that.
Of course.
For those of you watching on the video on Patreon.
I love my African material. So here we go. It's got fish on it, a sign of fertility. There you go.
We brought all the glamour for talking about the initiation of physiological birth today. What causes it to happen? What amazing interactions are going on in the baby, between the baby and the mother, in order for labour to start? Because there's a lot of complex things and we don't yet actually fully understand it. And Kemi and I are both passionate about the fucking with things we don't understand that is happening on a massive scale in maternity services, and the potential implications for that, some of which we know and some of we don't fully understand and are minimised, swept under the carpet, maybe not even known about by the people that are offering you inductions and elective cesareans before your body and baby are ready for birth without actually valid medical reasons for needing that. Obviously there are sometimes valid medical reasons, but not for the case with the vast majority of the population, because in some trusts now it's 70%, isn't it, that we're having induction of labour.
Yeah, they'll formally admit to that.
That doesn't include sweeps.
But we know it's much higher than that.
Yeah, which is really scary when you understand and know what's happening in the lead up. So that's what we're trying to share with you today, the important things that are happening in your body, in your baby's body, that are designed to make birth safe. Because contrary kind of cultural belief that birth is very dangerous all of the time and really bad, it is very safe the vast majority of the time and has always been that way. The things that make birth unsafe and always have made birth unsafe in majority of cases where things go wrong is when meddling has happened. In the past, that meddling was from people, for example, putting their hands inside women, out washing their hands because there wasn't an understanding of infection risk and of infection. So physicians would, for example, be examining body to understand about anatomy and then just go straight and put their hands inside a birthing woman. And so then the mother and baby would die from infection. And that infection rate was high. Back when this happened, there was a physician who said, we need to wash hands, we need to stop infection. And guess what the obstetric community did? Threw him in a mental asylum.
Locked up, don't let me out. Yeah, so this is what you've also got to appreciate, that obstetrics is only interested at what happens during the obstetric moment. So your child growing up with an impaired ability to have relationships or not maintaining their developmental progress or struggling in the school setting or struggling with education or not obtaining or realising their full career potential, that isn't directly traceable to the impairment that occurred in pregnancy, labour, birth and early infant nurture. It's far enough away from it, so they get away with all of the meddling.
Not having the full understanding of the processes and just things touching on what's starting labour, we're just touching on that knowledge, and we're just touching on little bits of research into the long-term outcomes of the effect of massive induction. Those studies, like the one by Hannah Darlin and her team in 2021, seem to be ignored in the NICE guidance. I remember at the time saying, why is there no mention of this massive population study over many years that shows the consequences of inducing early, of hospital visits, respiratory disorders, more asthma, more eczema, effect of cognitive function on children that is measurable up to 16 years. And the only reason that it's up to 16 years is that's the length of the study. But aren't going to suddenly change at 16 years. I don't think that you're going to suddenly miraculously no longer have asthma, cognitive differences that have happened as a result of choosing to end your pregnancy early.
Hence why birth has to be untethered from the system we currently have if we're to be doing right by women and babies.
These processes that are happening, as I said before, are designed to keep the baby and the person giving birth safe. And they are multi-systemic, multi-organ things that are happening concurrently, intertwined with one another, like this amazing kind of path to birth that is overlapping, intertwining, one affecting another, all coming together to the point where the baby says, I'm ready. The maternal body says, I'm ready. Positionally, things are right. Hormonally, things are right. Structurally, things are right. All of the organs, all of the hormones are all slotting into place for it to be safe for your baby to birth, as safe as possible, and for it to be as safe as possible for you to birth. And some of those things we know more about than others. They include all of the systems of the baby. So right up to birth, right up to hours, maybe even minutes before birth, there are changes happening in your baby that are preparing them for life outside of the uterus. Because life inside the uterus is very different to life outside of the uterus. For example, in the uterus, your baby's lungs really are quite closed. They're quite small. There isn't much blood supply going to them. There's actually a hole in the heart because we don't need the blood to be going in to supply the lungs, because the lungs are not doing the work that they need to do when the baby's outside. The baby is getting all of their oxygen through the placenta, through the umbilical cord. All of the waste products that would normally be expelled through the lungs, all of the oxygen that comes in through the lungs, that's not happening in the fetus. It's happening in the mother. The mother's doing all the hard work and helping the baby out. And so there's this big transition from these lungs being closed and not really used to them having to open out for the blood supply to be diverted to actually supply those lungs. And when the baby's lungs are not ready, it makes that transition more difficult. It makes it more likely that the baby's going to have breathing difficulties, need help to inflate their lungs, need help with oxygenation, not just in those first few moments, in those first few hours, in those first few weeks of life. Actually, as we've seen from these studies, that these have long-term effects on the baby's breathing and can cause increases in asthma and things like that. So in the lead up to labour, there's an increase in a substance called surfactant in the baby's lungs that's happening. And what the surfactant does is it helps to lubricate the alveoli of the lungs and the gaps between them so that they can pop open more easily when the baby takes their first breath. And I made a little model out of cling film for those of you who are watching us here, that when you've got, and if you can't see me, I'll describe it anyway, but when you've got two surfaces of cling film stuck together, that actually trying to peel them apart can be quite tricky because the surfaces are stuck together and they don't want to come apart. It takes quite a bit of effort for them to open. And what the surfactant is doing is meaning that when those surfaces are ready to open and come apart, that they come apart more easily. That's just one of the processes happening. And that intertwines, that surfactant release, with not only does it help the lungs to be ready to be born, but it's actually being released into the amniotic fluid and creating changes in the amniotic fluid, which affects not only the amniotic fluid, the amnion and the chorion around the baby, to increase prostaglandin release and white cell leukocyte release in the baby and in the mother, which helps to make the uterus, basically it starts like making the uterus more irritable, starting to trigger changes in the uterus, starting to trigger prostaglandin release in the mother, which starts to make changes in the cervix, starts to make changes in the membranes that make the maternal body, baby's body, more ready for it to happen. Pregnancy, the cervix is there to keep the baby in. It's firmly closed and tilted backwards. It's like, there is no exit here. I'm holding this baby in, I'm keeping them safe. And there are massive changes to that cervix in the lead up to labour. I know Kemi knows a lot about these cycle changes. She loves talking about juicy cervixes. Hoping she's going to jump in at some point very soon to talk about that. Going from this firm structure, it actually quite feels almost cartilaginous, sort of like the end of your nose, doesn't it? That when it's kind of firm. In the lead up to birth, this changing, the structure's changing from this closed, I'm not letting a baby out, to it's starting to soften. It's starting to structurally change. The structure of it changes. It's not just moves. It actually, the whole structure of it changes. It releases a lot of fluid. We get much more cervical discharge happening, which sometimes people mistake for amniotic fluid. It's actually the weeping from the cervix as that structure is changing. So you're getting things happening in the lead up to birth, but it's not quite ready yet, not quite there yet. And it's importantly interacting between the mum and baby. Are you ready? Are you ready for this? Are you ready for that? Just interacting in that way.
And there are so many interactions like that are being ignored by birth workers, or we are devising crude interventions to try and mimic that. And that's where you will end up with a mother, a baby not being aligned physiologically for this huge process of getting the baby from the inside to the outside in a timely manner that keeps that baby's health optimal and keeps the woman's responses to the expulsion as comfortable as possible. It's not meant to be totally comfortable because there's supposed to be hormonal changes happening in the woman that affects the way her body responds, that affects the baby's ability to descend and rotate out of her. So, as you know, in my expertise as attending birth and preparing women and their babies for birth, what I observe isn't seen by most midwives and obstetricians because they don't work in a continuity of care model where they're able to see all the steps. So when they're making suggestions around pregnancy and birth, we must understand that their learning and their experience only comes from a sliver of time. So unless they are feeling led to respecting this process from prior to conception, they're going to be making recommendations that probably aren't appropriate for most women and babies. Which is why, the invitation here is for birth workers to learn or revise from our sharing, but primarily it's for parents to realise their own responsibility for maintaining optimal health for themselves and their babies. So that's really interesting what you're suggesting with regards to what not waiting for spontaneous labour, the effects that it can have on the baby's lungs. And we know how important lungs are because they're an essential part of us being oxygenated. And we understand the role that well oxygenated blood plays in an optimal circulation, which feeds all of our organs I would say one of the most important ones, other than lungs, is the brain. So we're seeing effects on children's brains, but it's not seen in obstetrics unless it's quite a severe impairment to the baby's brain, which is hypoxic injury. So they can see that initially in obstetrics, but then the baby's quickly shunted into neonatology or pediatrics. So they don't care so much about that either. But you will if it's your child.
And if you are choosing to end your pregnancy earlier, your baby's brain is not ready for birth yet. There are important things happening in the last weeks, even hours, before labour is initiated that are making the baby's brain ready. So from around 36 weeks gestation, there is a lot of synapse formation happening in the brain. And with the baby being in the uterus, there are higher levels of certain chemicals that basically keep the baby in a more restful state, keeps their brain in a more restful state. They're more sleepy. They are not having to control with their brains lots of things that they have to control on the outside of the body. So in the maternal body, they are kept at exactly the right temperature by the amniotic fluid around them. So they do not have to expend energy or brain resources in order to thermoregulate. They are not having to control breathing because their oxygenation is happening through the placenta. So babies, or we are all actually triggered to breathe, not for a need of oxygen, but actually for an increase in carbon dioxide levels. In babies, that trigger mechanism, especially in babies that are born at earlier term, is not yet mature enough to work very well. And it's why we see increased risk of SIDS with babies that are born early, because that mechanism is not quite there yet. It's also why there's a recommendation for you to sleep in the same room as your baby, and actually preferably bed share with your baby so they're really close to you, because you breathe out carbon dioxide right next to your baby, it actually triggers them to remember to breathe, because that reflex for them to take a breath in. It helps, literally helps to save their life while their brain's still getting ready and learning and developing. And from around 36 weeks gestation, we are getting these formation of new synapses in the brain. And there's research showing that actually in some of the formation peaks that are happening, and we don't know when they're happening, not an exact time. In one person, it might be happening at 37 weeks, another 38, 39, 40, 41. We don't know. There are at some point over 40,000 synapses being created per second in your baby's brain. Someone's telling you your baby's ready to be born, let's have an induction. Why are we waiting anymore? They don't know. If your baby was ready and your body was ready, you would be in labour. Imagine they've told you that you need an induction at 38 weeks or 39 weeks. How many seconds, how many 40,000 synapses in seconds, if you've ended your pregnancy a week early, 2 weeks early, 3 weeks early, 4 weeks early, how many seconds are in that time? And how many 40,000 of synapses are disrupted in that time? I mean, it's such a big figure, I can't even comprehend that. It's a massive impact on your baby's brain development. It's not something to be taken lightly. It's not something to be taken on a guess of your due date. It's a guess.
And I'll also bring in the parents' responsibility here, because the amount of mothers that I know are asking for any form of induction, including membrane sweeps, because their partner's going to be home that week, or they've got parents coming over to, flying in to assist the family. So there are parents making these decisions. They must be okay, because maternity services are always recommending kicking babies out early. So I'll choose it because I've got help that week, or because it'd be so lovely for my partner to be here when my baby's born. But you've got to understand, already we've just addressed the impact of your baby having lungs that are ready for the world. You've got to understand that you're impairing your baby's brain, and you've got to really weigh up, is this really a good reason for me to impair my baby's brain?
You don't know what you don't know.
Did you see the look on my face? I don't think we can let ourselves off the hook anymore. I did this to my child. And if I can face up to it, if we all faced up to it, we'd be doing better for our children. Don't let yourself off the hook.
We're not, the thing is, I think that we are educated in such a way in our lives, and have been since the Industrial Revolution, and things really kick off, making rich men richer and richer and richer, and the rest of us ding into doing that for them, that we're set up in an education system where we sit still, be quiet, do what we're told by an outside authority. They know better than us. They know better than our intuition. They know better than our electrical feelings in our body. I use the example often when I'm teaching that you need a wee. You have to ask permission to have a wee. Like, excuse me, can I go and stop my bladder bursting all over this chair and my school uniform? And a teacher has the power to say, no, you have to wait till the end of the lesson. When that is, or we are set up all our lives, it can feel very, very difficult to say to an outside authority, to a doctor in a white coat, to somebody who's got letters after their name, that doesn't feel right for me, especially when there is a huge amount of arrogance. Medical professionals, I'm not saying all medical professionals, but it is a problem that has been highlighted in many, many reports of safety, that there is this arrogance that doctors know better. We know better. Be quiet, little woman. You don't know what you're talking about. So when this is the institutional narrative, this is the environment that we're growing up in, it's very hard to say no. It's very hard to stand up and say, I don't agree with you. That's not what I'm going to do. But that's what being a parent's about. The lead up to birth is preparing us. The experience of birth is it's preparing us to be parents. It's giving us hard things. It's giving us challenges and showing us that actually our body carries on anyway. There are points in labor where your hormones are at such a point that your adrenaline is high, your oxytocin is low, your endorphins have gone down. You are feeling the full brute force of those contractions. We refer to it as transition. The, my God, I can't do this moment. This is the death of you as a maiden. This is the birth of you as a parent, as a mother. So no longer are you just responsible for yourself and able to farm out that responsibility to other people, as you've been taught to do by society. Now is your point where you are choosing, am I farming out responsibility for my baby's well-being to someone else as well? You're no longer just responsible for yourself. You're responsible for the human or humans inside you. And it's a big responsibility, and it's very scary, and it's very normal to be scared about that. But it's what you've chosen by choosing to have a baby. And it is a big responsibility. But, time has shown us that the men above us, the white men above us, do not have our best interests at heart. They do not care about mothers and babies dying. They pay lip service to it, but they don't care. Because if they cared, they wouldn't be committing genocide to make themselves money, to grab themselves land. They wouldn't be ignoring every report into safety saying, we need to listen to women. We need to give individualized mother-focused care. We need to give continuity of care. All of these things improve safety. They wouldn't be bitching about doulas, shutting doulas out of supporting women when they're most scared, for example, in cesarean sections, saying there's not enough room when there's plenty of space in a theatre, for medical students, etc. When we know that doulas improve outcomes and make things better for mothers and babies. They don't care. We have got to save ourselves. We have got to make the right choices for us and our babies. And, whatever that choice is that's right for you it's fine. You might feel like, okay, well, I'm not really worried about asthma and brain effects on my baby because actually it feels really important for me in this moment to have my baby. And, other people might not agree with that, but that's what being a parent's about.
And I would also, be that bitch that would say, well, it's not fine because your baby is the one that carries the burden of your choices.
That's a responsibility you have to have as a parent, isn't it? You got to carry that forever. So make a wise choice, is what I'm saying. Choose wisely now so that you don't regret it and have to go to, great lengths of trying to renew, restore, fix, mend. Prevention is better than cure. There's nothing that you need to prevent in the moment. If your baby is not imminently or you're not imminently about to die, you don't need an induction. That's a bit of a mic drop moment, isn't it? Stunned Kemi into silence.
It's so grave. And obviously, this education, even just the nudge for parents and truly concerned birth workers to look more deeply into what not waiting for spontaneous labour and birth means. You're going to continuously encounter mic drop moments. And that's when you see sometimes those of us that are very obsessed with the whole health of humanity, that's when we get a bit screechy. That's when I get a bit South London F-bombs, because we all need to take more responsibility for the choices that we make for women and babies. So that's from the parents' perspective, that's for us and our babies. From the birth worker maternity sector, you know what? If you can't enable the best health for mothers and babies, you need to not be in that profession. It's huge. What other gems have you got to share with us, Shellie?
We've talked quite a lot about the baby, the impacts on the baby, and I think it would be helpful to also talk about the impacts on maternal body if you are ending a pregnancy early. So we talked a little bit about the cervix, and often methods of induction very much focus on cranking open the cervix, be that mechanically, it open by shoving rods in or a balloon in and inflating it and pushing it open, be that chemically by introducing artificial prostaglandins that are creating more of the breakdown of those structures and that going from that thing that's holding the baby in because the baby's not ready to come to forcing it to become more pliable so that it opens. So we've got this combination in the uterus getting ready for birth of the cervix going from holding closed to allowing itself to be pulled up and open. A bit like I was saying to someone the other day that I think of the cervix as like the biggest roll neck jumper ever. That you've got a roll neck for a giraffe going on and it's all bunched up and closed. And then, there's all this stuff happening in the sort of days and hours where the jumper's like gathering up here, but we've still got all of this stuff above the head before the baby comes out. All this kind of softening of the structures, like a breakdown of the starch in a jumper. So rather than it being holding everything, it becomes more floppy and pliable and able to open. But if you have got a mismatch between, so your cervix is being forced open, be that with prostaglandins or be that with a rod like jammed in and that's swelling up and like open, stretching open the neck of your jumper. Don't want an overstretched jumper. That's what's happening. Maybe the uterus above it, myometrial cells in the uterus are not ready. Okay, if we don't have enough oxytocin receptor sensitivity, so we get this, though we get a gradual increase of oxytocin in the lead up to labour, it's not like suddenly a massive jump. And I think often there's a lot of emphasis on you've got to increase your oxytocin, you've got to, so there's this, because there's all this pressure on mothers. You're not relaxed enough. You're too stressed to go into labour. It's like it's your fault you're not going into labour. Chill out, have a bath, bounce on your ball. There's all this sort of like pressure. It's like he's not going into labour because something's not ready, not because you're too stressed, because you've probably not got enough oxytocin receptors yet. Your uterus isn't ready to be safe. And if you don't have enough oxytocin receptors, what it means is that contraction that's happening in the uterus is more discordant. Like with Braxton Hicks, where you're getting this kind of tightening of the uterus, it's sort of doing this. It's not doing a coordinated contraction that's drawing the uterus up and starting to bring that roll neck jumper over the baby's head, or starting to open it out above the baby's head before it gets to the head. So you can crank open a cervix with mechanical methods. We know it happens with induction. But if your uterus isn't then ready to contract effectively, labour's not going to work because it's not ready to work. So what you get is then artificial oxytocin being introduced, which doesn't have the same effects as endogenous oxytocin because it's not being released from the brain. And so we don't get an increase in endorphin release that helps us cope with the sensations. Far more artificial oxytocin is put into the system than would be released naturally. So these contractions are incredibly strong and discordant. When you get a cramp in a muscle, I don't know if you've ever had cramp, it is one of the most painful, intense feelings ever. What's happening to your uterus when you're getting artificial oxytocin? It's like cramping up really strongly and not in quite the right way. So it's like pulling the jumper over the head a little bit wonky and not quite right, not strong enough to push the baby down in the right way so that they can make the rotations they need to come out. And so babies end up in funky positions. They end up stuck, ends up not working. And what's that deemed as? Failure to progress. No, it's failure to wait until the uterus is ready and it's safe to do so.
It's a failed induction.
You're forced more and more and more to try to contract this uterus that's not ready to do that. It's like going to a gym for the first time ever, having never lifted a weight, and someone putting your body weight on the barbell and going, lift that. No, you can't do it. If you try, you're probably going to injure yourself. Body's not ready for that. It needs to be ready.
That failed induction, which is what we must call it, because that's the truth. And once we know the truth of it, then we know how to fix that, potentially not do the induction. Yeah. So you've got what Shellie could see.
Don't until your body's ready.
Come on. Right. So we've got the cervix that isn't ready to open, but we're going to force it open. Of course, all the discordant action can happen to a point, but what you will normally find with failed induction is that something has to be done to the woman and the baby in an attempt to get the baby born. So it's like getting a screwdriver, but what we're going to do is we're going to drive the screw in with a hammer first, so we have to turn it less. But what we're doing when we do that is we're destroying the thread of the screw and whatever you're trying to screw it into. And so you've got something that is suboptimal, and the labour and the birth for an induced labour and birth will always be suboptimal, will always require an episiotomy or forceps or ventouse, or it won't complete at all for the reasons that Shellie mentioned earlier. If the oxytocin receptors aren't sufficient, doesn't matter how much oxytocin is around, there aren't sufficient receptors to mop it up. If the receptors aren't sensitized to the oxytocin, they won't respond in a complete way. So you're seeing there's so many areas here where there will be incompletion, suboptimal, not quite ready, and all of that based on, well, your baby's ready because you're 37 weeks. can you begin to see how the knock-ons that you get from not waiting for spontaneous labour, the breadth of them far outweigh what could be done to help you to wait?
The major things about the uterus not being ready and not having enough oxytocin receptors and then being saturated with artificial oxytocin is that it then cannot contract down. You've had your baby to effectively birth your placenta and prevent you from hemorrhaging. And so we are seeing massive increases in postpartum hemorrhage. And what does the medical institution blame? Women getting older and fatter and more complex. What is actually to blame is more interventions. I don't know if you heard my husband in the background, Dr. Patriarchy, just shouted, older, fatter. he's in character.
So wonderfully inappropriate.
It was in character of Dr. Patriarchy from one of the Instagram reels. But yeah, so women are blamed for the problems that are being caused, the iatrogenic harm, the harm caused by medical interventions. You were told were necessary, but actually, are they? Only you can answer that question for you, because I don't know about you, but for me, a less than 1 in 1,000 risk of stillbirth when I'm feeling well and intuitively connected with my baby and my baby feels well is not enough of a reason to mess with all of these things and have all of these consequences in the short term and the long term. But maybe for somebody else that is, it's an individual choice.
Yes, it's an individual choice, but you've got to remember what you're signing your baby up for the rest of its life.
And you as well. There's a study that's just been released, actually. I haven't read the study yet, but I just saw this morning from the fabulous Dr. Sarah Wickham's email. I'm going to have to read this research paper later, but a study examined the association between mode of birth and depression and or severe anxiety and followed women up until 14 years after birth. It has shown that induction increased depression and severe anxiety. Findings provide no evidence to support an association with other modes of birth with maternal depression and anxiety. And that's part of the hormonal cascade that is happening in the lead up to birth and throughout birth and at the end of birth that is disrupted by induction and by cesarean. We get this amazing oxytocin peak that is higher than at any other point in our life. I don't know how many times better than an orgasm oxytocin peak it is, but it's like massive. It's like off the scale, massive.
Yes.
And if you have an epidural, because those oxytocin contractions are so difficult to cope with, you don't get that. You don't fall in love with your baby in the same way. Your baby does not experience that oxytocin peak in the same way. It changes the blueprint for how they experience the hormonal love, the thing that creates love in our body, the thing that creates connection, fundamentally changes that. And yes, you can try to bridge that gap by spending a lot of the time skin to skin and building it with breastfeeding and being close to your baby, but it does have an impact. We know from research that people who have had augmentation of their labour or induction of their labour and use of synthetic oxytocin, that people describe their babies as more difficult, more annoying, more hard to handle, even when there are no differences in the baby's behaviour compared to those who have birthed physiologically. This is the thing, it's a multi-system thing. It's affecting everything. It's not just one little thing, it's affecting everything. The whole way that you are feeling, interacting with your baby, in your body's function. With the introduction of artificial oxytocin, it changes that oxytocin peak. It messes around with the prolactin, and prolactin helps us cope. It's a mothering hormone. It helps produce milk for the babies. It helps us cope with the monotony and repetitive nature of caring for babies. It makes us placid about that. It makes us more fierce in the defense of our babies. And that doesn't suit the men who want us to go back to work and want us to be in the factories and the jobs to make them money. It doesn't suit them to have women that are fiercely protective and want to look after their children. It doesn't suit the pharmaceutical industries. If we are so fiercely protective of our babies, we start to question Why do you want to give my baby a vaccination for hepatitis and things that are sexually transmitted when they've just been born? Why do I want to have that? Disrupting these processes makes us more compliant. It makes us say yes to the man. We don't need to say yes to the man. We need to say yes to the experiences of physiological birth.
Yes to our bodies, yes to our processes. And it's also yes to that tiny amount of times where there may be baby loss, because actually there's no amount of inductions that is going to prevent baby loss. And we now know that induction is increasing the chances of baby loss or illness for babies, morbidity. So you might feel, okay, I'll allow the process of induction and augmentation for my child to avoid the minuscule chance of, stillbirth or neonatal death. You might choose that, think that's a wise choice, but what are you exchanging it for? Especially as we know that it's not reducing the chances of stillbirth and perinatal death. In fact, what we're seeing is an increase, and then we're seeing an increase in illness for babies. So if we start to honour ourselves as women and our processes and the children that we carry inside of us, when you look at it overall, you'll realise that in almost every case, waiting for those processes is best.
Yeah. We'll do a future podcast about when actually pros induction may outweigh cons.
Yeah.
But for me, and in evidence, to the reasons that are being given to try to justify induction are just not valid. For a high BMI, geriatric, week of gestation, any week of gestation, skin colour, your ethnic background, not good reasons for induction. There isn't evidence to show that induction improves outcomes because of these reasons. And you're being sold a false hope of reducing something that is very, very scary. For most people, probably the scariest thing that could ever happen. But actually, in reality, this intervention is not doing that. It's not reducing that. Very thoughtful, hard-hitting episode so far, hasn't it? Which we're going to leave everybody a bit depressed at the end, aren't we?
This is the untethered part. I'll bring that back in. Those of us that are truly serving humanity are not tethered to these systems that aren't. We may have passed through them, but then we stand outside of them. And it takes responsibility to do that. And they're not going to be comfortable conversations always. But there's so many systems within the mother and within the baby inside that work together so beautifully that you ought to be aware of. We've touched on some today. It goes deeper, and Shellie has a resource for that, for the mothers that want to do a deep dive, and for the birth workers. You have to know it. And like me, I went through the whole of my midwifery training without knowing a lot of this. I had to go and find out once I had the headspace and was on the register. But at least I went to find out, which meant that I was going to be of more benefit for women and their families. It's really important that we know these things. Parents, I understand that there's not even a smidgen of a hint to any of this. But I want you to now consider, now that if it's been put before you for the first time, dig deeper, find out more about how all the processes connect to optimize brain health, lung health, kidney health, liver health, digestive health, your emotional health, your endocrinology. It's all can be perfected in the conception, pregnancy, labour, birth, and infant nurture process. And it'll be for you to find out the depth of what you need to know to convince you to trust yourself, optimize your own health for the sake of you and your baby ongoing. Because like for instance, when Shellie mentioned that piece of research that was shared this morning through the magnificent Dr. Sarah Wickham and her birth information update, when I saw that piece of research as well, it speaks to the availability of the mother to the baby that is now outside. So the baby's been expelled by whatever means necessary, with not much thought to medium and long-term outcomes. But then the baby is being raised by that same woman who has an anxiety disorder or is depressed. That's going to have an effect on the well-being and growth of the baby, the whole health of the baby. We can't reach for these easy fixes for health anxiety or our resistance to accepting responsibility as mothers. It's not easy. It is hard work. We make mistakes, but we really must try.
I think when you come out of a situation, if you feel that you have tried to get as much information as possible to make a decision and you've done everything you possibly can, it feels very different to when you've been railroaded, coerced into making a decision, if that makes sense. And I think that when you are first pregnant and you don't really know a huge amount of births because it's not a priority, it's not taught in school, we're not have any of this knowledge given to us, and not just in school, but from what you touched on there, in midwifery training. This information is not there. I had a midwife on a course I was on recently, talking about their birth and rupture of membranes, and then labour didn't start, and they waited at home for a certain number of days before their labour started, just because they didn't want to go into the hospital system that they'd been training in and knew that it was unsafe and where they wanted to be. And of course, there was a bit of pressure to, infection risk, you need to come in, you need to have, your labour induced and augmented in order to get it started. And she was just like, why did my waters go and then labour not start? And I said, well, you probably just didn't have that sensitivity in your oxytocin receptors. Your uterus wasn't ready yet to birth your baby safely, and so it was waiting. And the infection risk isn't massive unless you've got people putting their hands into your vagina. So if you don't have anything going in, then the infection risk is very low. And if you're just keeping an eye on your body and making sure that you and your baby are well, then you can just wait. It's a very safe option to just wait. And I would argue, unless there is any signs of an infection, the safer option, because you don't then get that cascade of intervention that is unnecessary. Your body's gone, okay, well, we've had some structural changes. We've had some prostaglandin release. We've had cortisol release. We've had, you get this kind of cortisol feedback mechanism in the uterus where, in the amniotic fluid, where it enhances effects of and various other substances that are irritating the uterus and getting it ready for birth. That process hasn't played out yet. And so the body's like, I'm not ready yet. So yeah, the waters are gone, but we'll just keep replenishing the amniotic fluid. Everything's good. We'll just wait until we're ready. It'd be crazy for our bodies to be designed to kill us and to kill our babies. The whole point of life is to perpetuate itself. Actually, often the thing that ends up being more dangerous is messing with those processes, interrupting those processes, blindly interrupting those processes when we don't understand things. And we're always going to make new discoveries, and we're always going to learn new things. And we can only go on the information that we have in the moment, but get that information. Everything in your gut is saying to you, not really sure I want to do what this doctor says, or not really sure I believe that this poking fingers up my vagina and rummaging around in my cervix is necessary. I'm a bit uncomfortable, so I'm thinking I'm going to say yes to it because they're telling me there's no consequences. They're telling me there's no problem. If someone tells you there are no negative consequences to an intervention, they are not telling you the truth. There are consequences to every action. There are risks with everything. There is no risk-free choice, and the responsibility is on you to decide which choice feels best for you in the moment.
Boom.
Thank you very much for joining us today, everybody. Remember to check out our Patreon. We've got some of the extra resources, extra information, deep dives. There are links to courses that both Kemi and I have. There's information about how to work with either of us on an individual basis if you want to have a call. We both offer power hours or chats on Zoom, whatever you want to call it. Power hour is just such a cool name for it, isn't it, really?
I think so. I should have patented it.
You should have. Everyone's stealing it. It's was it imitation is the greatest form of flattery? I love that. Everyone's
Ben.
You should be flattered. You should be flattered. Yeah, but if you have individual circumstances, you're thinking, well, somebody's telling me this, and I'm not really sure, and they're kind of pushing me into it, but they're not really giving me information to help make my choice. That's why we both offer those sessions, so that you can have time with us, talk through what you're thinking, talk through what you're feeling. We can give you more information, so that you can make the choice that feels right for you, because it's your choice. You are the one in control, and you can stand up and say, no, I'm not doing that. That is not the right choice for me. And I encourage you to stand up for what feels right. It might be yes on that intervention, but we want that yes or that no to come from a place where you have an understanding about the potential consequences of your different decisions, so that you can feel, no, actually, that decision was the right one in the moment. I feel okay about it. So that you don't have any regrets. So you don't look back and say, I did that without thinking. I did that because I was pushed into it. I did that because I was forced to do it. You want to look back and say, I did that because it was the right choice for me at the time. Hope you all have a lovely day. Thank you for joining us.
Thank you.
Take care, everybody.
Remember, you can join us over on Patreon for extra resources with every episode and a growing community of physiological birth rebels. This is The Revolution, and you're all invited. The information shared in this podcast is for educational and informational purposes only and should not be construed as medical advice. The views and opinions expressed by guests are their own and may not reflect those of the hosts. This content does not replace professional